So we asked, what are the most significant challenges you all face in purifying multispecifics? And it seems like the majority of people said managing molecular stability and aggregation. So, Mark, like you said, aggregation is a very pervasive problem. How do you guys react to that? Is that expected, that response?
I mean, like I said, it's at least for us, it's the one thing that tends to be common, and to some extent, it's just getting used to working with whatever the particular product is. It tends to differ from product to product. With a little bit of, once you get into a program, you start to understand there's pHs that may or may not be friendly to your product. People often add surfactants to try to prevent the new generation of new aggregates. Personally, I find that using surfactants can help you with a lot of stuff, but not with the aggregates very often.
Really?
One of the things, depending on the team you're working in, if you've got formulation people who are early in the project, a lot of times they can tell you a lot about what your molecule wants and doesn't want. They can start to understand, the colloidal stability of your molecule and how things like ionic strength and pH and other things affect that. Maybe carbohydrate, maybe sugars in the solution. So if you do have the luxury of having formulation people working with you, a lot of times they can be a lot of help.
Yeah. Thanks, Mark. Jen, anything to add there?
Just personally, in my experience, aggregation hasn't been the biggest issue. So I'm a little surprised to see these poll results. But I think definitely the heterogeneity of the multi-specific may lead to stability issues that they may be maybe more prone to bind together or form some heterodimer. So I think this could be happening for a lot of like bispecific molecules, and it really depends on the engineering of the molecule itself. And really want to echo Mark's point, involvement or knowledge from the formulation or pre-formulation folks can really shed light for us during the process development to understand, what the molecule likes, right? Just in general. So that's a very important information to have if possible.
Yeah. And when you guys say to enlist the formulations folks and kind of get them involved, at what point do you think would be most optimal? Are you talking upstream or at the top of downstream? Like whereabouts do you think this communication and collaboration should best take place?
Well, I think generally the formulation people need something that's relatively pure before they can start making measurements that are helpful to them or us. But also a lot of times you can get a pretty pure prep quickly, maybe with a process that's not economically viable to move forward with, but is enough to give formulation people something to play with and make measurements on. So, almost as soon as the upstream people have a process they're starting to feel comfortable with, if you can.
Yeah, I would agree that collaboration or interface can happen as early as possible. In our experience, we basically rely on both teams, right? From us, we rely on the purification, on the formulation team to understand the molecule's property and what it likes. And on the other hand, just like Mark mentioned, they rely on us to produce some early purified material to do formulation development. So it's definitely a win-win situation when we involve them early.
Yeah. Well, it's also kind of a difficult dance because when everybody gets going, the downstream people want the upstream people to stop adjusting things, and the formulation people want the downstream people to stop adjusting things. But in reality, everybody has to keep working. So, it's kind of an interesting dance to coordinate.
Yeah. Any advice to folks in coordinating that dance? Any mistakes to avoid that you've seen in your time in industry?
Gosh, I don't know. Nothing that more time and more money doesn't fix. Jen, I
Right.
don't have a good answer. How about you?
So we do rely on our CMC management team. So we do have like dedicated CMC lead person, and that person may coordinate some activity between both upstream, downstream, and also drug substance and drug product, or the development formulation, right? So I think having some more dedicated people overseeing this whole process could definitely help, because everything is all on the same page for them. And we sometimes coordinate some minor details on ourselves, but the bigger picture is better to have some gatekeeper to have an eye on it.
Yeah.
Yeah, that's a good point. By the way, one of the things that that person or the team can do, even if they don't have that person, is if while upstream is doing their development work, if they can create a temporary lock where they're supplying downstream with something that's not moving while they're making improvements, and then downstream can do the same thing for formulation, provide them with something that's not moving while they're making improvements, and then everybody agrees that improvements get rolled out at an agreed upon time, and everybody then sees how it changed their workflow. But one of the most difficult things, for a formulation team is to have downstream keep tweaking it every week. And one of the most difficult things for the downstream people is upstream keep tweaking it every week. So it's good to have, a temporary lock, and you don't have to live with it forever, but you want to live with it for a while so that people can get their bearings.